Hi, everyone. It's Karen Anderson here with Aortic Hope for your week in review. If you are new to Aortic Hope or you're new to our week in reviews, this is just an opportunity where we're going to share with you all of the things that we posted on our social media platforms. It's really for those of you that are not on Facebook or not checking out our website, which you should do. We just wanted to share with you some of the things that we shared with the community last week. So feel free to leave your comments below. But most importantly, please click subscribe so that you're notified every time we have a recording that comes up here and when we start doing our live videos and shows again. And please share this at the end because it really will help educate and bring awareness ASAP, because awareness saves aortas, period, to the community. So let's get started with our Medical Monday. Medical Monday, you guys. All right. This is all about aortic valves for the month of February. It's actually about heart valve disease awareness, but in our community, we limit it basically down to the aortic valve. In this particular week, which was last Monday, we were discussing one of the disease elements that we can have, which is aortic regurgitation. So what really is aortic regurgitation? It's kind of like it sounds, right? So Adam, Dr. Ahmed, did a great job really introducing us to what the aortic valve actually is and its different components. So if you missed that, check out the week before underneath the blog and you'll find that information. But he taught us to really kind of think of the aortic valve as a one-way door between your heart and the rest of your body. And so normally this door swings open, and when your heart beats, which lets the blood flow forward, okay, and then it snaps shut tightly to prevent any backflow. Normal aortic anatomy, simply meaning that the anatomy that involves the aorta and that valve, which is really the higher percentage of people that are born with, include 3 leaflets or 3 swinging doors, okay, that they work when they're working correctly. They come together perfectly to form this seal, which prevents any blood from going back into the heart. Okay, they go in, they go out, and they form this great seal. And here's a great picture of what normal leaflets look like. Now, some people can have 2 leaflets, which is bicuspid aortic valve. Some people can have 4, which would be quadcuspid. Some people have 1, right? So the normal valve, and which most of the population has, is like right here with 3 leaflets. So when the doors open, they're open, and when they close tight, they form a seal so that blood does not go back into the heart chamber. So there is a little bit of space when there is aortic regurgitation. And in that space that's created, really in here, there would be more space than you see now, that blood will leak backwards into the heart with every single heartbeat. And so the term regurgitation like literally means flowing back, which is exactly what's happening. So here is your valve where it connects to the aorta to the heart. And you can see here's the aorta in a normal working valve. And this is your valve, and it closes. And this is the blood that is coming from the left ventricle going up. It's all that oxygenated, rich blood. It's going up the aorta and will come up the arch and down to feed all that blood to the rest of the body. Well, when you have regurgitation or backflow, this valve becomes really floppy and it doesn't close all the way, which allows some of that blood to go back into the heart, and that can be very problematic. So aortic regurgitation is really a lot more common in people that have bicuspid aortic valves or 2 leaflets, connective tissue disorders like Marfan or Loeys-Dietz syndrome, or those who have had aortic surgery. I had aortic regurgitation, so this is all hits really close to home. So why does that valve even start leaking? So there's 2 main categories. You could actually have a problem with the valve, like you have bicuspid, which is something you're born with. It's not something you develop. It is a congenital heart defect. You could have an infection, which damages the valve, like you could have developed endocarditis. You could have rheumatic heart disease, or you could have been born with some type of valve abnormality. Aortic problems. So if you have at the base of the aorta, which is the root, and the aortic valve, they are very intimately connected. Okay, they're like literally connected. When the aortic root tends to stretch too wide, maybe due to an aneurysm, the valve leaflets, those three doors, they can't reach each other to close properly because it's been stretched due to an aneurysm. So they can't close properly as if there weren't an aneurysm. Okay. And aortic dissection actually disrupts the valve sometimes from functioning correctly altogether. There's also some changes that can happen to people after aortic surgery. So these are the main categories as to why you would have a leakage in your valve to begin with. So for those with connective tissue disorders, this is why your doctor watches your valves so closely, because when the aorta enlarges, again, it can pull the doors or the leaflets apart. So how do doctors manage this? An echocardiogram or heart ultrasound is the cardiologist's and surgeon's favorite tool in managing your heart valve. And it gives them a great image of the heart's function and shows how much blood is actually leaking back into the heart. And then they're able to grade the degree of the aortic regurgitation as either being trace, mild, moderate, or severe. And that really helps influence your treatment options. So in the image I'm about to show you, the black and white picture in the top left is a view of the heart on an echo that they're evaluating for aortic regurgitation. See, there it is. That's regurgitating from your valve, which is enclosing right there, okay? And in this coming week, we actually cover more information about bicuspid valves and what that really means to people, because that is another common issue that'll happen to aortic valves, but that's typically something, again, that you are born with and not something you develop, like regurgitation. So just know that with regurgitation, and we were going to get into treatment options at some point in the month, depending on the treatment option, depending on the valve you choose, makes a big difference in how the approach to treatment is handled. My approach was I did go with bioprosthetic, and a lot of times people can have that put in place endovascularly, but I had to have mine open. So I had a second open heart surgery, and it's not about me today, but I just wanted to share with you, there's a couple different options and ways to go about treating it, but it is monitored through an echo. That is one of the cases where CT scans are not the best for determining what the blood flow looks like, although a congenital or heart MRI can show that as well. This is one of the things, talk to your physician. And if you have a question about why you're having certain tests, ask. Remember to ace your healthcare journey by advocating for yourself, communicating, and educating. Okay, that is your Medical Monday. All right, let's get into Topic Tuesday. Okay, so Topic Tuesday. We didn't even wait a week. My mistake. We went right into bicuspid valve last Tuesday. So, and that's, there's a lot of information when it comes to the valves, especially when we talk about, heart valve awareness month. So, awareness, it truly saves lives. And that's why we're going into the details. But did you know that 1 to 2% of the population is actually born with a bicuspid aortic valve? And you wouldn't know it. You wouldn't know it until there was a reason. You were symptomatic, or there was another reason for an ultrasound or echo or CT, and then it gets picked up. But this is what a normal aortic valve looks like. That's what a bicuspid valve looks like. And what's interesting is that area right here, or seam, is closed, whereas this is open, creating 3 separate leaflets. This one is closed, smushed together, which actually creates 1 leaflet and a second leaflet. So instead of having 3 leaflets, it has 2. And it's the most common congenital heart defect that exists. And many people, again, like I said, they don't even discover it until they become an adult. And so for some people in our community, it was found because when a physician listens to your chest, which is why stethoscope exams are so important, they can hear a murmur. That's the first clue. And for others, it's sometimes imaging. Because of something completely unrelated. And for some, it was actually discovered when they had a dissection or they had to have an aneurysm operated on. So why does bicuspid aortic valve awareness matter? Bicuspid valve is not just really about the valve itself, because over time, when you have only 2 leaflets, aortic stenosis can occur. and that is narrowing of the space between your leaflets. Aortic regurgitation can occur, which would be floppiness, and it causes leakage. An enlargement of the ascending aorta occurs, which could lead to a thoracic aortic aneurysm or dissection. And research shows that a bicuspid aortic valve is associated with changes in the aortic wall, which is why monitoring the aorta is just as important as monitoring the valve. And this can run in families, contrary to popular belief. It can. So there is often a genetic component to this, and current guidelines really recommend that you screen your first degree relatives with an echocardiogram. Okay, non-invasive. So if you have one, have your siblings, your parents, and your children receive an echocardiogram. They should at least talk to their physicians about being screened. Now, when you have a bicuspid valve, there could be some symptoms that go along with this. It could involve shortness of breath, chest discomfort, fatigue, dizziness or fainting, or that heart murmur that they can hear. And some individuals really will just feel fine for many years. And that's why having regular follow-ups is so important, because just because you're diagnosed with a bicuspid valve doesn't mean you need any medical intervention, right? So it's following along and being monitored and letting your physician determine when it's time for some type of medical intervention, and when necessary, surgical or transcatheter intervention. Now, long-term outcomes are very good for people that have a bicuspid valve. At Aortic Hope, we truly believe that knowledge empowers, community strengthens, and early detection protects. So, this is Heart Valve Awareness Month. You need to know about your valve. You need to know your numbers as far as, what your potential aneurysm is or what your valve is doing. You need to know your family history. You need to encourage screening, and you need to share this post because someone you love may or may not know that they have bicuspid valve already. So great article. Hopefully you got something out of it. This is why we ask you to share, because sharing is caring, right? And awareness saves aortas, period. That's why we want you to share ASAP. So that, my friends, is your Topic Tuesday. Okay, we are also celebrating Black History Month, and we wanted this year to really honor pioneers and modern heroes in heart and aortic care. So this Black History Month, Aortic Hope is honoring both Black pioneers and modern day heroes, really, whose groundbreaking work has kind of shaped the cardiovascular and aortic medicine research and patient advocacy. Their contributions have expanded knowledge, have challenged inequities, and improved outcomes for countless patients and families. So from advancing research and clinical care to educating communities and lifting patient voices, these trailblazers laid and continue to lay the foundation for better, more inclusive heart and aortic healthcare. We celebrate their legacy, recognize their impact, and remain committed to carrying their work forward through awareness, education, and support. So let's talk about a couple of them. Here's pioneers in cardiovascular and aortic care. Dr. Daniel Hale Williams. He was known as the father of Black cardiology. Dr. Williams actually performed one of the world's first open heart surgeries in 1893. 1893. He repaired a torn pericardium, which is the sac that goes around the heart, and a wound to the internal mammary artery, which is a major branch of the aorta. He also founded Provident Hospital, the first non-segregated Black-owned hospital in the U.S. Okay, Vivian Thomas. Though initially Vivian was hired as a janitorial lab assistant, Thomas became a master surgical technician at Johns Hopkins. He was instrumental in developing I'm going to mispronounce this because I do butcher words, the Blaylock Taussig Thomas shunt. I did not pronounce that right. I know I did not. This shunt was actually a procedure that was used to treat blue baby syndrome. This condition often involves an overriding aorta, and Thomas's surgical interventions were critical in managing these complex surgical heart and aortic defects. Dr. Levi Watkins, he was a legendary cardiac surgeon. Dr. Watkins performed the world's first successful implantation of an automatic implantable defibrillator. Say all of that fast in a human patient. His work advanced the surgical techniques used today for various heart and major vessel repairs. And then we have Dr. John Beauregard Johnson, a pioneer in cardiac angiography and catheterization. Dr. Johnson was the first to use these techniques in studying the heart's internal structure. And his research, it was vital in understanding the impact of hypertension, which is a leading cause of aortic aneurysms and dissections on African American population. So these pioneers, they just didn't innovate in the operating room. They built the institutions that support Black medical excellence today. Dr. Williams co-founded the National Medical Association to provide a professional home for Black doctors that were excluded from other groups. And later, Dr. Richard Allen Williams, he founded the Association of Black Cardiologists in 1974. And that was to address the disproportionate burden of cardiovascular disease in minority communities. And today the mission continues as researchers work to address why African Americans face a higher risk of cardiovascular death and earlier onset of conditions like hypertension, which directly impacts aortic health. Modern day surgical and clinical trailblazers. Dr. Robert Higgins, a renowned cardiothoracic surgeon. Dr. Higgins is the executive director and founding member of the Association of Black Cardiovascular and Thoracic Surgeons. He previously served as the surgeon-in-chief at Johns Hopkins Hospital, where he led advancements in complex heart and lung transplantation. Dr. Africa Wallace. In 2023, Dr. Wallace became the first Black president of a major surgical organization, the Eastern Cardiothoracic Surgical Society, one of our big supporters. As the director of thoracic surgery at Capitol Health, she specializes in minimally invasive and robotic surgical techniques for treating aortic conditions. Dr. Allison McLartley, a surgical leader at Stony Brook Medicine. Dr. McLartley specializes in aortic disease and mechanical circulatory support, ECMO. We've talked about that before. In January of just this year, 2026, she was honored with a Healthcare Heroes Lifetime Achievement Award for her contributions to cardiac and thoracic surgery. Dr. Elon Burton, I hope I'm pronouncing your name correctly, is a clinical associate professor at Stanford Medical. Dr. Burton's a pioneer in robotic MIDCAB, minimally invasive direct coronary artery bypass surgery, and she recently made headlines for collaborating on a highly complex combined heart-lung tumor resection. Like, this is mind-blowing stuff. Let's talk a little bit about leaders in research and advocacy. Dr. Clyde Yancey, Chief of Cardiology and Vice Dean for Diversity and Inclusion at Northwestern University. Dr. Yancey is a leading voice in heart failure research and identifying systemic health disparities that affect Black cardiovascular patients. Dr. Anthony Fletcher, installed as the president of the Association of Black Cardiologists in 2024. Dr. Fletcher leads national initiatives to reduce cardiovascular disease in minority communities through education and advocacy for a more diverse medical workforce. Dr. Elizabeth Ofili, a researcher and former ABC president. She's instrumental in studies like the African American Heart Study, which investigates genetic risk factors like LPA to improve precision medicine for Black patients that are at risk for aortic and heart disease. It's important that we share this because representation matters. It's important because progress saves lives, and it's important because awareness saves aortas, period. So we hope that you enjoyed learning about our past trailblazers and our current exceptional medical staff that are just also in their own right trailblazers, and that you enjoyed celebrating Black History Month with us. Okay. It was also National Library Lovers Day recently. It was a day ago. If you love a good library, you're going to love this even more. So Aortic Hope has a community of individuals that have helped to create its own library. Some patient guides and educational resources to stories written by the community for the community. These materials are here to support, educate, and remind you that you're not alone on this journey. And if you click on our link that is provided in this blog post, or you go to resources, you'll be able to find all of the resources that we have, books, poetry, everything that's been written by community members like you. And whether you're checking something out for answers, if you're looking for comfort or just a little encouragement, our shelves are always open. No late fees, just lots of heart. So grab a cozy spot, click through our published resources, and explore knowledge that was created and lived experience and hope at the center. Learning empowers, community matters, and awareness saves aortas, period. I'm going to keep saying it all the time. But it was National Library Lovers Day. And again, if you go to our resources, you can just scroll down right away. You're going to see we have our free download for aortic disease, the patient guide, and then aortic dissection, the patient guide, both in English and Spanish. You continue down and you will see there's our reading resources. I'm not going to go through them all because I've done it before, but really talks about beyond our books, poetry that was written by an aortic dissection survivor. All of these were written by survivors. Tons of books in here. So I find it just amazing that we have such incredibly talented and brave individuals that are willing to share their stories, with the community. I think it's wonderful. Okay, we're moving on to a Survivor Series replay Saturday. This was all about Michael Pace, who did a Spartan race last year, and he's doing it again this year, raising funds for Aortic Hope. It's a powerful story from Michael about how he survived a type A dissection. And he is very involved in that grueling sport of Spartan races. But when you get a chance, you can click the link, check out his story. It'll take you to our YouTube channel where all of the survivor stories and stories about where they are now are found. And we want you to be the shining light in someone's life by submitting your own story of survival. Or your story of caring for someone with aortic disease, because by submitting your story, it's really going to be very validating for others and also maybe provide some insight and create questions that they can take to their own physician when acing their healthcare journey. So don't discount what sharing your story actually does for others. And there is a link for you to fill out a form to join that as well. And we hope that you consider doing so. Okay, it was Share With You Sunday, this past Sunday. And if you've watched or you would like to rewatch or you've not watched our interview with Dr. Kristen Watson, you really need to. I mean, now is a perfect time. We're at the beginning of the year, and Dr. Watson does a phenomenal job of breaking down the common medications that are prescribed for individuals with aortic disease, why they're used, how they work, what side effects to watch out for. It's all done in a way that really helps make sense. It makes everything easier to understand. This is one of those interviews that every patient and caregiver should have like in their back pocket. You remember, knowledge helps you actually advocate for yourself and ask better questions and feel more confident in your care. So if you ever wanted to know what a beta blocker was, or an ACE inhibitor, or a calcium channel blocker, or an angiotensin receptor blocker, diuretic, great time for you to check this out. Take a few minutes, review the interview, learn what's prescribed and why, and share it with someone who could benefit, because understanding your medications is part of taking control of your healthcare journey. Okay, it says First Friday fundraiser, but it's in every single week for the entire month of February. These are our seat belt covers. They look pretty much like more like a combination of the very first one we ever had and our most recent one. It is a really wonderful cotton breathable fabric that wraps around your seat belt or your dog leash or your backpack strap. I mean, it really can go anywhere that you're going. And typically we offer these with an $18 donation, $23 for international. This month in February, I'm sorry, international has to stay $23, shipping so expensive. But for those of you that are domestic with a $14 donation, you can pick one that's either red or black with the saying aortic disease or medical alert. So don't delay, grab your swag today, right? Instant medical recognition for EMS providers because we have that universal symbol that is on the belt. And it's really great for people living with aortic disease. Doesn't matter if you have Marfan's, if it's a thoracic or abdominal aneurysm where you survived a dissection, you have aortic disease. That's all that an EMS person needs to see. Plus, inside the pocket, you can put the specifics about your personal condition, the medications you're on, any allergies you have. All your individualized stuff goes on the inside. And again, red or black with the two different sayings. There is an order form here. There's also a donation link. You can also go to our Hope Shops and you'll find this information there as well. So that's going on all month long. But in addition, and there it is. There's our order form right there on our Hope Shops. In addition, we have through our spread shop right now through the end of today, you have 25% off and everything. You just click the redeem button just like that. And we're talking about, oh my goodness, let's look at the hoodies and sweatshirts, all different types of logos. Here's our Canadian logo, our original full logo, our icon. There's a couple other logos that are in here as well. Our Aortic Keep Fighting logo, Caregiver logo. There's a lot of stuff and a lot of merchandise, a lot of fun accessories. Even stuffed animals are in here. See, we have a few that have been selling out. So there's a lot of choices. And all month long, there's going to be additional sales. I think we have another one coming up on the 18th, maybe. I think it's 20%, or it could be another 25%. So keep your eye on here. Just click redeem. You don't have to enter any codes, and anything you order will be that percentage off. So don't delay, grab your swag today because wearing swag creates awareness. And I guarantee you someone's going to ask you, what's that logo? I get asked all the time when I wear it. What's aortic hope? Okay. So I think we are finished. We can take a look at the events for the rest of this month. And what we see is we do have our WISE meeting on the 22nd, which is Women Inspiring Support and Empowerment. And we also have the last support group of the month coming in on the 24th. You just need to click this link. It takes you right to a form that you can fill out to join, or take a look at all the other support group meetings that we have and click what's in red and you can fill out the registration form and you'll be notified by email whenever we have an event, and all you need to do is join. So that is what we have for you for this past week. I hope you found it informative. I hope you found it engaging, interesting. If you did, leave me a comment below. We've got more incredible information coming up for the rest of the month, including more sales, contests, etc. Hope you check it out. Click like, click subscribe, and click share because someone else will find this to be very informative, and awareness saves aortas, period. Thanks so much and have a great rest of your week.